I decided to talk to my nephew, who's a doctor. I went to Italy, took some X-ray, and he suggested to do a hip replacement surgery. I had a pain with my hip since I was young because I was doing sports. Deteriorated maybe about 6 years ago. I was born in Italy 75 years ago and studied in Italy, started working at IBM in Italy. Then I immigrated to Canada about 47 years ago and became a Canadian citizen in 1982 and worked in the computer software development and communication area. I became a consultant, then started business in the US in 2005, and I'm in the middle of starting another business.
So this patient came to me with a severe hip arthritis. And on top of that, he had difficulty in walking for a long time with constant pain over his right hip. That's why he asked if I can perform a hip replacement, but with a condition that I do it with the anterior approach.
A series of searching on the internet. I didn't want to go to Canada where it would be free. There is health insurance, but I couldn't choose the hospital, I couldn't choose the doctor, I couldn't choose the type of surgery. Basically, it's in the hands of somebody you don't know. And so I decided to look around, and I found where it was relatively inexpensive. Then I looked at the Philippines, and it seemed that the Philippines has a culture that is more similar to the US, the language, everybody knows English, and plus, it's a Catholic country. I enjoyed this type of culture, and so I looked on the internet and I found Dr. Tec. Also, my doctor in the US is a Filipino doctor, Dr. Go, and so I knew there was talent in the Philippines.
So, as I said before, the patient had very severe arthritis, which is a condition wherein the cartilage has already worn out. But on top of that, this patient also had acetabuli protrusion, which is when the socket deepens inner or down to the pelvis, and that it makes it more difficult in terms of trying to reconstruct the acetabulum so that we can place the cup in an anatomic position. Yeah, the Providence Hospital, I believe, is at par with international standards of surgical care in terms of safety. And we have modern equipment and also high quality surgical team. And we also exhibit a very good post-op care. And I'm proud that I am part of the Providence Hospital for providing this kind of service to the patients.
It was relatively new, clean, people were very kind. No particular problem, so it seemed to be a good hospital.
For me, it's important to identify if patients do have any concerns immediately after surgery. But the day after surgery, we ask the patients to stand already and be able to gain confidence in ambulation. So initially, we do daily post-op visits and physical therapy visits. And then after that, we monitor them weekly, the wound, and also for the physical therapy, we have 2 to 3 times we have to regain muscle strength and to prevent any hip stiffness.
But Dr. Tec was very detailed and liked what he said. Here I found out that the next day after the operation I was already standing and taking some steps with the walker. So I'm happy with the frontal type of procedure and happy with the results. Oh, what impressed me most, I think, is the way this operation is done. It's amazing. I mean, they can do a small cut and do all that work inside my body and close to my bones and insert the prosthesis and do all that. It's just amazing. It's almost a technological, state-of-the-art type of thing, and that's the most impressive thing, I think.
So first, you have to follow your rehab plan. You have to be very religious in terms of what the doctors say to you, because that's how you recover smoothly. Number two, you have to listen to your body. If your body says that you're overdoing it, then stop doing it. And if you feel some kind of pain in some certain movements, then you should stop doing it and then call your doctor about it. Just remember that although we perform the surgery and the hospital helped you through it, you are still the ones going to heal, and you are still in control of your body.
Look around, find a good doctor, and do what I did, I guess. I don't think I could have done better. Would I consider, you mean recommend it? Yes, I would recommend it. If anybody asks me, or if I know of anybody with a similar problem, as I said, Dr. Tec is, in my opinion, one of the top doctors, certainly in the Philippines. Thank you very much. Thank you very much. That's the main thing.